get my notes to show on my screen. I might just have to do this sans notes. Okay, right, we're gonna wing it. Okay, so transparency, fairness, consistency, coordination, and predictability. So I guess what I really wanted to sort of touch on today is obviously, communications is, as Hugh said at the very beginning, risk communications in particular is a core aspect of managing international health regulations and risk in the context of public health emergencies. And of course, it's not the only intervention that is used, and we obviously know that. And I think before kind of going on into the communications aspects that I want to share today, I wanted to just sort of touch that these cross-cutting principles obviously apply to those other interventions and not just to communications, but I'm going to focus on communications and stakeholder engagement today. So hang on, are you changing things around for me? Someone's taking control and we're back. Okay. Hugh, are you presenting on your end for me now?
Yeah, I'll present your end so you got your notes as well then.
Oh, you're super kind. Thank you so much. Okay, thank you. So these 5 principles apply to all aspects of managing a public health crisis, as you know, and I said I'm going to focus on communications and stakeholder engagement. And as Katrine said, stakeholder acceptance to any intervention or buy-in to what you're asking people to do just won't happen if you don't apply the principles. We know that communication is not a single step or a component of crisis. It must be fully integrated with the crisis response, and that's something that we talk about when we did the risk communications training seminars as part of the Sharp Joint Action for Health work back in July of 2019 when we met in Vilnius to talk through some of the core components of the project. Effective communication should not be done to a target audience in the same way that public health interventions cannot be done to a target audience. There needs to be that two-way partnership and that understanding that we need to work together and create a shared understanding of the outcomes that we want to drive. And I think it's important as well to say that, the vision is going to trump the information, and that's where the emotional aspect comes in. And Katrine touched on that when she talked about the 4 strategies. So understanding people's motivations and the barriers for them in terms of following the regulations, helping people to feel that they're in control and engaged, and helping them to live their lives but reduce risk, and acknowledging the hardship that people are going through. So if I move on to the next slide, what I'll cover today very briefly is a brief overview of how we've carried those principles throughout all of our response work. And I'll also hopefully demonstrate the interconnectedness and value of these principles, not just in combating fatigue, but also in all approaches to communication. So moving on again, what did we do from the outset of the pandemic? Well, exactly what you would expect the communications team of a public health agency to do. Internal communications, external communications, working with media partners and political stakeholders as well. Proactive campaigns to really work to get those messages out there. We worked very closely with the media from the very beginning, stakeholders and partnerships, and working with social media as you would expect. And the big question, I suppose, that many people have asked me is, how was it different for you, Leah, running a team and running the communications for a public health agency through the pandemic that we've been living? And for me, my answer to that is that it's just been more volatile, more uncertain, more complex, and more ambiguous than anything that I've experienced in my career, and probably more so than what many of my team have experienced, certainly in their careers as well. So if I move on again and just focus a little bit more on what we did during the first kind of part of the pandemic, and what we've done in this presentation is we've just kind of put the key at the top to show which aspects of the cross-cutting principles we applied to this, bearing in mind what I'm showing you now is the examples of the work that we did in the first half of 2020, and I'll move on to what we're doing now. So it's kind of a retrospective review of the work that that Kathleen talked about. And when we looked at how we applied our campaigns, we did find that predictability and consistency were two key elements. So in the first 4 months of the pandemic, we applied ourselves really hard to consider how we were going to get the messages to people. And we focused on 3 campaigns in the first few months. The first one was a thank you campaign. The second was around public health protection and sharing the specific messages so people could understand what we were asking them to do. And the third was a specific campaign around mental, social, and physical well-being. So that first one, if I move on to slide 6, you can see some famous faces. They're probably famous for people who live in Wales or the United Kingdom. But this is one of the things we did was work with people who are very well known in communities in arts and culture and sports to thank people in Wales for following the rules. So this was about using social norming and rewarding positive behavior rather than trying to use scare tactics or be heavy-handed in the messaging. And if I move on to the next one, I wanted to show you very briefly the work that we pulled together around mitigating the negative impacts on well-being. And we talked, in terms of the 4 strategies, acknowledging hardship and addressing that. What we tried very early on to address and acknowledge that the mental aspects and the social cost to people. I think that my observation on that is that over time, I think what we see across all of our societies is that more people are affected more. So this campaign came quite early on in the pandemic, relatively speaking, but I think it was very powerful because we were tapping into the words on everybody's lips, which at the time was asking, like, how are you doing? And people really kind of wanting to look after each other. So we use that as an anchor to share a whole suite of messages and resources to support people or allow people to support themselves, enabling them to engage with the material and choose ways that were best for them. So if I move on to the next slide, we can skip across that one. That was just sort of another image showing how we developed and rolled the campaign out across all of our channels. So all of our digital channels, we did paid advertising, radio, etc. Slide 9, really quickly, just to kind of wrap up on the third campaign that I referenced, was around developing a suite of materials that just explain really specifically what the public health interventions are. And we felt that this was important for transparency and consistency, making sure that people could have an explanation for what we were asking them to do. One of the things that was really important is that we had to leave a lot of room for adaptation along with the situation. So we needed to have flexibility in the messages, but we retained a very, very high degree of consistency in terms of the branding and the voice, providing clarity and showing that we were always on and always there to provide the messaging that was appropriate at the time. So if I move on then to slide 10, what does that look like? What do those 3 campaigns look like at this juncture 1 year on? Well, interestingly, I think what we can say is that we've found the application of those 5 principles to be quite useful, so we're moving those forward. In January 2021, and I think, Kathleen, just for you to know, we prepared an advice paper and submitted that to Welsh Government, and the structure of that advice paper actually followed the framework of the 4 strategies that you set out, and we worked with our behaviour science team to put forward some advice to government about how here in Wales we could apply those strategies and bring them forward into some of the actions. So just to kind of reinforce how influential your work has been on that front. But back to our review, what does it look like 1 year on? We're continuing to deliver campaigns for our publics, but we're taking on new approaches and applying different and new resources with what we have now, which is a better understanding. So at this space and time, we have a better understanding of people's motivations and barriers, and we're working really hard to engage with people. And interestingly, we're coming back to some of the emotional messaging around thanking people for their continued commitment. And part of doing that is addressing the emotional aspects of information fatigue and behavior fatigue. So if I move on to the next slide, then I'm on slide 11. I wanted to share with you some of the things that we're doing now that are a little bit different than in the first half. So what we wanted to do is to really build on trust, and we know that the most trusted voices in terms of health information are health professionals. And so for that reason, we wanted to bring a really human face to the communications that we're pushing out. And I know there'll be a number of people on this call today who will recognize Giri Shankar, Dr. Giri Shankar at the very bottom. And we've pulled out that article. We managed to place a really long form profile of Giri into Wales Online, which has got quite a bit of coverage here in Wales. And the reason why we opted to do that was to really make the information more relatable, humanize our experts and the information that they're sharing to help build on that trust that people have in the public health experts and in health professionals. We really believe that recognizable faces making regular appearances and becoming well known build on that trust and provide that real consistent voice. And one of the things that's special about, you can see the top 3 examples there, Dr. Richard Roberts, Dr. Catherine Moore, and Dr. Shika D'Souza. The reason why we chose this particular aspect is because it demonstrates a fairness and a transparency element in addition to the consistency and the coordination. And what I mean by that is that we opened up our experts to answer questions from members of the public, and we chose to answer the difficult ones, the awkward ones, the questions from anti-vaxxers, you name it. And we wanted to make sure that by doing that, we were giving members of the public the opportunity to raise the issues that are important to them and ask questions that matter to them. And we also wanted to make sure that we were working in ways that allow diverse communities to feel that they're represented and feel that they can access information from people that they recognize. And I'll come on to the stakeholder work in just one second. So if I move on to the next slide, the stakeholder engagement piece has been increasingly important for us. So what we're working to do is develop a really strong two-way method of keeping engaged with various communities. And Hugh actually has been extremely involved in developing that and really building it out from our starting point back in February of 2020. In February of 2020, what we started with was just trying to rapidly get together some stakeholder lists and send information out and push information out to key groups just to make sure that they had it. And since then, what we've been able to do is to really recognize the multi-sectoral collaboration value, improve the stakeholder communications work, create two-way dialogue. So this is really about engagement and really just touching back on Katrine, what you talked about before around, helping people to feel that they're in control, using local voices to disseminate messages because they are talking to their communities in a voice of trust. We develop new approaches. So I'm really proud. I'll show you on the next slide, actually, some of the easy share materials, the WhatsApp groups, tailored email updates that really reflect what the groups and people were asking for. We were pushing through on accessibility and really pushing and increasing the bar and the level of excellence in terms of people with sensory loss or other types of accessibility needs. Working with strategic partners to make sure that two-way feedback and putting public health messages out there is not just the Public Health Agency or the Public Health Institute in Wales, but actually it's members of communities where people recognize their peers or recognize their elders or their community leaders. So we were hoping today, and unfortunately the timing didn't work out, to come to be joined by somebody from Muslim Doctors Cymru, who we've been able to work with really closely in this most recent period, because we have a vested interest, shared interest in helping communities to stay safe from coronavirus. So if I move on to the next slide, I wanted to share this one because it shows you a picture on the left-hand side of the WhatsApp group that Hugh has been working to set up, which for the public sector is fairly innovative. So we know that people are on kind of dark social and working in spaces that we can't measure and access. So we felt that it was important for us to be able to create messages and information that communities and individuals could disseminate within their voice, within their communities. So again, this is about having safe and trusted messages and thinking about applying learnings. This is something that worked really well in the Zika outbreak in northern Brazil, and we took quite a lot of learnings from the case study around that piece of learning. So if you want to ask about that later or hear more, I'm happy to talk about that. we created a specific web page, you can see that in the middle at the back, where people can go and pick the information that they want to share on their social media and on their channels, enabling them to disseminate our messages more widely. And the item that you see on the front on the right hand side is the same thing. It's a Padlet, and it's a format that allows people to share and use and disseminate the signed off public health messages that we're creating, but doing it in a way that's really easy. And that was one of the things that was really important. You know, a really quick example of why listening to communities is important. From the very beginning, we got involved with networks and we were asking them what they needed. And clearly the virus having emerged from Wuhan, which is, you know, in China, we reached out to the Chinese community in Wales and became aware very quickly that whilst we were offering to translate materials into Mandarin, what the Chinese community told us is that we don't want to have it in Mandarin. Thank you very much. Actually, we require this information in simplified Chinese, and they were even able to help us reach out to a specialist translator to get that work done. So it was just a really simple example about when you ask your communities and you get back really valuable two-way information. And of course, moving on to slide 14, you can see 4 wheels. I won't pause on this for too long because I want to get to my last slide, which I think is my, or second to last slide, is my killer slide, really. You know, of course, it was important on an ongoing basis to evaluate the work of the stakeholder engagement. So making sure that we're actually checking in and seeing if this work is helpful to people. My slide 15 for me is something I'm extremely proud of, and I sit here in Cardiff in my home office with this on my desk, and this is the Communicating Risk in Public Health Emergencies toolkit that was pulled together by the WHO and published in, I think it was 2015. And we use this as a document to guide our training and thinking about risk communications. And Giri and I were talking about it quite a lot before the pandemic, and we discussed it at one of the SHARP joint action meetings in 2019 as well. And one of the pieces of evidence in there is that if you can increase trust, that leads to an increased compliance with public health action and regulations. So that's why I shared this slide, because I feel like as a team, we've really reached the holy grail of risk communications and public health communications. So on the second line down, you can see that Public Health Wales has a trust rating of 72%, second only to health professionals who traditionally prior to the pandemic would have had a very high level of trust from the public. I don't think that many people in Wales would have necessarily known who Public Health Wales was before the pandemic. We're now very much under a lot of scrutiny and in the public spotlight, but to have achieved a 72% of our population who were surveyed say that they trust the information that's coming from us is a real evidence point around what we're doing is working well, and we need to continue to build on that. So I guess that's my pitch, and kind of trying to show some ways in which we've applied the 5 cross-cutting principles in our work, and maybe some examples that you can feel free to ask about later. And my last slide really is about, well, what have I learned in the last 12 to 16 months? My big takeaways are we've been able to reach new audiences in ways that we never would have had the opportunity to do before. So I would always say never waste a good crisis. Going from, 20,000 followers on Twitter to over 70,000, reaching over 250,000 members of our Facebook community groups, being able to, some of our Facebook posts were reaching in excess of 7 million people per post, which is shocking because our population is only 3.5 million in Wales. So I'm not, I think what this tells us is that we were telling a story and we were carrying a message that people wanted to hear. So it's not because we're such an amazing communications team, although we are. It's really the message there, the lesson is that we were carrying that message, and that's enabled us to grow our reach and our audiences. Through that, we've had to be extremely agile. So I've showed you quite a few examples of the work that we've done, and that's really only the tip of the iceberg. We've had to remain very, very agile, but alongside that, stay very consistent and transparent and predictable, and act with fairness. So I think for us, it's about making sure we capitalize on the opportunities as they come along and use the information and the insights that we get from our stakeholder networks. And finally, my little emoji with my smiley face and my 3 hearts, which is always for my team. So there are 30 of us that work on this in this division, and I'm ever so proud of the work that we continue to do in the face of COVID-19. So I'll leave it there, and I'm very happy to take questions either now or later.
Thank you, Leah. Again, really interesting, kind of really thorough overview of everything that's happened in the past year. It's hard to believe just how much has gone on in that time. Are there any questions? Any questions people have for Leah? I know we've gone slightly over in time, but we can make that back later on. Anybody have any questions or observations? No, we can always circle it back around to again some questions later on in the final plenary session. Thank you so much, Leah.